Namaskar. Myself Amit Shaw. I'm speech and solo therapist at CNCI Kolkata. And today we have Dr. Shyamadip Tade, head and neck surgeon, specialist grade 2. So today we are going to discuss about thyroid cancer. So sir, I have few queries. Okay. Next question is, what are the types of thyroid cancer?
The thyroid cancer happens when the cells which are forming the thyroid gland, they undergo some kind of genetic change or some kind of genetic mutation. There is some change in the normal cell structure of the thyroid gland. So what happens is there are two basic categorization of thyroid cancers. One is the differentiated type and the other is the poorly differentiated or undifferentiated type. So in differentiated type, we have the most common cancer, that is the papillary cancer of the thyroid gland, which is around 80% of all the thyroid cancers in the body. So usually the patient presents to us with a swelling in front of the neck, and there are small nodes which are there in the neck to which this thyroid cancer initially spreads to. And sometimes the patient also presents with small swellings on either side of the neck. So that is the papillary cancer. This is called the good cancer of the thyroid gland, because if we do a proper treatment and we diagnose early, then there is less chance of the cancer coming back. The second kind of thyroid cancer is the follicular cancer. Now, follicular cancer, the characteristic feature of follicular cancer thyroid is that the cancer spreads to the bones via their bloodstream. So we have small pulsatile swellings which appear on the scalp or on the arms and on any bony surface of our body. We first suspect that the patient has follicular cancer. Next, we have something called the medullary cancer of the thyroid gland. Now, medullary cancer is a very separate kind of thyroid cancer which runs in the families. It's very common that a medullary cancer in a father, and then it is transmitted to also the child. And there is a specific genetic mutation which happens, and it usually is associated with not very good prognosis. And the last cancer, which is the most dangerous kind of thyroid cancer, it usually happens in patients where the thyroid cancer is not treated. Then these patients go for de-differentiation. The cancer changes and it becomes something called anaplastic cancer of the thyroid gland. And this anaplastic cancer, we cannot, there is not much scope for treatment. Usually the patient, after diagnosis, usually the patient dies in a few months because it spreads really rapidly.
Okay. So next is, what are the risk factors?
So the risk factors, especially for follicular cancer of thyroid gland, is that for the thyroid gland to function normally, iodine is very important. Iodine and salt is very important. Now, if the water is deficient, the water which we are consuming, if it is deficient in iodine or salts, then the thyroid doesn't function properly, and then it might lead to cancer formation. So in hilly areas where the rivers are usually deficient in thyroid in iodine, then in those areas we usually find these kind of follicular cancers. So it's very important that the patient, we all consume iodinated salts, so that the thyroid gland functions properly. Patient usually should look for swelling which is gradually increasing in size in front of the neck. Patient suddenly has sometimes patient also presents to us with change of voice, or there is difficulty in swallowing, or the swelling is slowly gradually increasing in size, as well as it is becoming painful. So these are the small changes or small symptoms which a patient should look for. And if they come across such things, then they should immediately show an ENT specialist or at least a head and neck cancer specialist.
Okay. So the next one is, what are the treatment options available?
So the word cancer comes with a lot of fear. it immediately, when you utter the word cancer, the patients become very fearful. The thing is that we don't need to be worried about cancer so much in this day and age, because there is a lot of improvement in treatment in terms of surgery, in terms of radiotherapy, in terms of chemotherapy. So for thyroid cancers, usually papillary, follicular, or medullary cancers, the mainstay of surgery and the mainstay of treatment is surgery. Now, sometimes in case of papillary as well as follicular, sometimes the surgery is followed by consumption of a radioiodine tablet, which totally neutralizes the cancer, and there are very less chances that the cancer comes back. Sometimes when the cancer cannot be operated or cannot be treated, then we take the help of radiotherapy, as well as there are new drugs, chemotherapy drugs, which have come, which particularly targets the cancer cells. And these are called the targeted therapy. We have a lot of new drugs which are coming up, which have a lot of promise in this day and age.
Okay. So thank you for answering all the questions beautifully.
Thank you,
Namaste.
Amit. Thank you, Amit. Thank you.